Hey everyone, it's Dr. Rick, and before I start my morning shift, I thought I'd give my patients some ideas about influenza. So there's always been a backlash of people that don't want to get their flu shot, and it's a bit different than the COVID shot. COVID is, I think, still experimental, but it has been put out there for people who have high risk. And if you have high risk, number one, try to eliminate the risk, reverse the disease, and number two, stay away from communities or functions where you can be exposed to large populations of sick people. Like on a plane, wear an N95 mask, please, and wash your hands at all times. Or if you have somebody in the house, wear an N95 mask and wash your hands at all times and don't share anything. So the idea, what I wanted to get across today is about influenza. The influenza virus is typically labeled as H something, N something. The current, or the most popular ones are H1N1 or H3N2. Now, those numbers don't mean too much, but what we do is try to classify what you're getting in your shot. There's let's just call it a 3-part shot and a 4-part shot, quadrivalent and well, I guess we don't have to get into that, but you just have to know that you get a shot. And for those of you that don't want this shot, honestly, it's been around for a long time and it is really safe. And I am still seeing influenza as of April 11th, 2025. There's still influenza in my other job. By the way, the videos I put out have nothing to do with my work with the hospital. So if you have any questions, please take the information here and take it to your primary care doctor. If you're one of my patients, message me on Get Healthy and or my phone and I can give you some advice. And this is the advice I'm going to give. Number one, I am really confident about the influenza shot. I do believe that it helps. Unfortunately, you're going to feel like somebody knuckled you in the shoulder for about 2 days, and you might have a little bit of a fever, maybe some body aches, but that's okay. That's part of the body's reaction to develop antibodies to what is thought to be the most prevailing influenza of the year. And if you have antibodies to those two HN combinations, you should be, in case you get exposed, protected. Meaning you'll have a little bit of an exposure, you'll have a little bit of a, say, body ache or a fever, and then it's gone. Now, if you don't take the shot, whether you're healthy and an athlete, one of my athletes, or you're unhealthy and you're maintained on a whole bunch of medicines, you're going to suffer. And let me just say it this way. You don't have to suffer. Honestly, please consider getting a shot. The way the shot is formulated, it's a different shot every year. It's a different combination of those 4 or 3. And the way it's figured out is the CDC looks at what's happening in the southern hemisphere the summer before our fall and winter. And whatever's happening in the southern hemisphere during the summer, our summer, is going to probably come to us in the fall and winter. So that's the predictive value, and there's other algorithms, and AI is used to calculate and figure out what we're going to need in the shot. But again, it's been around so long, as far as I know, at least 30 to 40 years, maybe 30 years, and it's been refined. So it used to be thought that if you have an egg allergy, that you don't take it. But honestly, nowadays it's considered safe, generally safe for even people with egg allergies. So who should get it? Pretty much everybody, especially if you're older than 60 or younger than 10. There's a little bit of a break point where how old your pediatrician can help guide you, and you'll probably get your shot at your pediatrician's office, in addition to the whole mess of other shots for the babies that are developing. And that's exactly why, is because when a baby's developing, there's no exposure except for whatever mom was exposed to in her past, and she transfers her antibodies of protection to baby. That's one of the reasons why moms get tetanus shots, boosters before delivering, is because you have a little bit of a bump up in your antibodies and then you transfer that to your baby. Baby's protected, because I don't think we want to give shots that early to, as far as tetanus, to a child, to an infant, newborn. So an old person that is technically immunocompromised, greater than 60, oh hello, should be protected as best as possible, whether it's barrier protection, distance, or if you are working in a healthcare environment, the shot. Now, it doesn't always match up, and sometimes you'll still get influenza, but again, it should be really tamed compared to what I've seen in outcomes here. People cough for like 2 to 3 weeks, interrupting their night, bringing up phlegm, not necessarily exposing everybody else, but that's not a fun thing. And then in the worst case scenarios, uncontrolled diabetes, smokers, they go on to have months of coughing. So it is very important, whether your asthma is controlled, whether you stopped tobacco last month and you're quitting for good, or you have elevated T2D or type 2 diabetes and you have an elevated glucose level that is just kind of controlled, you have to be careful because your immune system is off. So who else has to be worried? Well, we have a lot of lung sufferers, a lot of rheumatologic sufferers that are on the MABs. Those are those injections that help calm down the body's response to autoimmunity, Crohn's disease too, in fact. So all those things that protect my autoimmune patients, thyroid, skin, joint, gut, or lung, well, they certainly help you through that, but they lower your immune system. So you too have to be careful. That's why it's important to stay away and watch yourself. Thank God for those shots. It makes people with those disabilities, and I call them disabilities or medical problems, makes them get through their life without much suffering, but you have to be careful when you get exposed. And I do think that everybody, no matter what, should be exercising. I would take your exercise down a little bit, but 75%. I don't want you to stop exercising. I think it's still healthy, but you don't want to be diverting all your energy that's supposed to go to the immune system to your muscular system, because the immune system is going to fight back and give you a crash the next day. So what do we do? Number one, if you have symptoms of cough, runny nose, red eyes, body aches, fevers, and chills, call your doctor or go to your immediate care center. I think the immediate care centers that are connected to big hospitals are better than the freestanding immediate care centers, because you can, if you're a doctor that works in an immediate care center, you can refer to somebody that will see that person as a dovetail to your treatment plan. But if you are going to an independent, like I think Midwest and a couple of the other ones I've seen, those small ones, you can get in and out, but they can't connect you with anybody to follow up with, especially those of you who don't see doctors because you don't have any symptoms and you feel fine. So I say that sarcastically, honestly, but and if you do have a diagnosis of influenza, or you don't want to go, it's mild, and you just got exposed to influenza A or B, I think it would be important to, number one, swab yourself. You can go to, I think, CVS and Walgreens, last time I went, have a COVID influenza swab that you can use, pretty reliable. And if you're positive, or you have exposure the old-fashioned way back in the 90s, if you're exposed, I would give everybody this stuff. This is Tamiflu. Tamiflu is a prescription medicine. This too has been around for a long time. And it's supposed to be given within the first 48 hours. That's the protocol. But for me, I give it to my patients even if they've been 4 days, 5 days out from the exposure. I think it might help. It'll help more if you get it in within the first 48 hours. It'll help less, but it'll still help after that. Some colleagues just don't want to give it after 48 hours, and that's fair. You're following the rules, but we should always follow the algorithm, but first follow your heart and your brain as far as, is this person suffering? Is there any downside to this? No, we give it down to 6 months, not 6 months of age or less, but you have to get that approved by your pediatrician, but down to 6 months it's approved for. Even pregnant women it's approved for. So it is a safe medication, and it can reverse your symptoms very quickly if you didn't get the shot. So my suggestion is, number one, please get the shot next time or consider it. If you're not sure and you want to debate me, then become a patient and you can debate me. Otherwise, I'm not going to waste my time with you. So you can also consider taking my herbal concoction. I like zinc, I like quercetin, I like astragalus, I like red reishi mushroom, I like the Host Defense throat spray, and nasal sprays. I think all those things I usually deploy, but I did get the shot this year. I have been exposed, I constantly get exposed from October until now, and I use a mask, a cheap mask, and I still haven't had an outbreak. So, knock on wood, it is dying down. But if you look at the CDC's website for influenza outbreaks, they'll give you a map and it'll show your state, and it'll tell you if you're a bad color or a good color. I think Indiana and Illinois are lime green, which is good. And I think it's going to be moving away, but it's still cold outside. And there's probably going to be 1 or 2 snowfalls left in the northern region. So Until we have everybody getting outside, you'll probably have packed conditions, you'll probably have super spreader events, and you have to be careful, even the kids. There's a couple of daycares in the area here in Indiana where half of the population is gone because, again, they have outbreaks. So it does happen, and unfortunately, if you have your kid in a daycare, incubation time, super spreader school, but it's necessary. So stay healthy. If you have any questions on those herbs I just mentioned, please either message me or put your comments in the comment section down below. I'll give you my other videos I did. And again, you can take care of yourself by swabbing and asking your doctor if they can prescribe this over the phone. If they don't, I think most insurances do have a virtual doctor visit that you might be able to take advantage of. If you're one of my patients, get on the phone, text me on the private phone, or message me and get healthy. I'll get you taken care of. Hopefully shorten the time period of suffering, and then get you back to exercise, proper eating, dieting, maybe a little bit of fasting here and there, and then enjoying the summer. So